So this is absolutely fascinating. So an interventionalist has recruited a patient into the study, they performed the angioplasty to the best of their ability, achieved what they feel is an optimal result, and yet in a quarter of the patients, the vessel was still ischemic.
Right.
And in 80% of those cases, there was still focal disease that had been missed.
Correct.
So this means that perhaps we're not understanding the angiogram very well, even though these are expert operators, and this is showing us that the physiology is demonstrating something that we hadn't appreciated or seen.
Well, I think there's a couple other lessons here, right? The first lesson is that this is not even average angioplasty.
Yeah.
This is better than average angioplasty because remember, everybody had a physiology assessment in the beginning.
Right.
Which is also, not, I mean, how often does it happen?
Yeah.
10 to 20% on average in the US or in the UK. So this was 100% physiology guided, if you will. So only those lesions were in fact addressed that were significant by physiology.
Okay.
And even in those cases, we only have, 75% success, if you will, 25% still have significant ischemia.
Right.
So that's a pretty interesting finding.
Well, it's an eye-opening finding, isn't it? Because it really shows us that we've got to up our game if we're going to be able to help our patients.
Well, it also shows that we need to transform how we use physiology, right? Because it's not a spot measurement, it's what we discussed before, using that pullback to identify how to best treat the vessel.
That's really eye-opening stuff, and I think it's something that we should all be integrating into our practice.